The next disease for us to discuss is cancer. Now, first of all, when we discuss about cancer, what is the meaning of cancer? Cancer is nothing but an uncontrolled and unwanted growth of cells. Just remember this, that it is nothing but an uncontrolled and unwanted growth of cells. Now, the main problem why cancer has remained such a big problem even now is we don't know the exact pathway or exact reason behind how cancer happens. There are certain risk factors that we know of. For example, we do know that chewing of tobacco or heavy smoking and alcoholism can be leading to cancer. But many cases it does not even lead to cancer. Doesn't mean that you start smoking or drinking. But what I'm saying is that we do know that yes, these are major risk factors. But at the same time, we do not know in certain cases that why cancer would happen or why cancer would not happen. So that's why this has been a major problem with cancer, or let's say the diagnosis of and treatment of cancer, that we don't know the exact reason why cancer is happening. We do know that it is nothing but an uncontrolled growth of cell where the cells are not dying and they keep on growing. And once the cancer becomes malignant, or this is where it starts to spread to other parts of the body as well and becomes much more dangerous. So it is an uncontrolled and unwanted growth of cells. No definite cause has been arrived at so far. Then by proto-oncogenes activated by some substances or stimulus which convert these into active cancer causing oncogenes. So what are proto-oncogenes? Proto-oncogenes are the kind of genes that can be converted into cancerous cells or cells that can become cancerous. So those are called as proto-oncogenes. So there are many substances, for example tobacco and alcohol, etc. It can convert proto-oncogenes into active oncogenes. That is, now they can start becoming cancerous. So this is what happens generally that we know of, but specificity of the entire process is something that is still to be properly understood. Now when we talk about cancer, there are few factors which can lead to cancer that we know of. Chemical or toxic compound exposure, ionizing radiation, genetics. Genetics can be a reason, and that's why sometimes we have seen that it has been seen to be hereditary in nature as well. Heavy smoking and alcoholism, chewing of tobacco, and consistent irritation of skin or repeated injury at the same place. Even this can lead to cancer. So that's why we know of certain factors that can lead to cancer. Remember that these are not the exact reasons. These are factors that can lead to cancer. It may not, but it can. So that's why these are some of the factors that we know of which can lead to cancer. Apart from that, when we talk about some common types of cancer, you have breast cancer or prostate cancer, skin cancer, colon cancer, and a tumor which can become malignant. So these are some common types of cancer, some common areas in our body which can develop cancer. Apart from that, there are others as well, but these are some of the ones which have higher number of cases in the world. Apart from that, there is lung cancer also, which often is seen in people who are smokers or especially heavy smokers. Then leukemia, a kind of cancer of blood forming tissues which basically hinder the body's ability to fight infections. So what happens is that the white blood cells are not able to multiply and grow in numbers that you normally would want to, and ultimately this is something that leads to leukemia. And then you have lymphoma, which is a cancer of the lymphatic system. So all these are the different types of cancer. Now when we talk about cancer, we know that this is a kind of a tumorous growth. That is, there is an uncontrolled growth of the cell. Now there are three different kinds of uncontrolled growth that can happen. The first one is called as a benign tumor. Now benign tumor is something that remains localized. So wherever, in whichever part of the body the benign tumor might have grown, it will remain confined to that area. And that's why in many cases this kind of tumor does not even lead to cancer, does not even grow into cancer, and it is something that is very easily treatable. Then after that you have pre-malignant tumor. So pre-malignant tumor are the kinds of tumors which have a potential to become cancerous. They have a potential to become malignant. That's why they are called as pre-malignant. So pre-malignant tumors are the kinds of tumors that may grow into cancerous cells. and then you have malignant tumor. So malignant tumor is the problem. Malignant tumor is where the tumor that has grown in one part of the body, it can start to spread over other parts of the body as well. So this is the kind of tumor which is called as malignant tumor. So it spreads to other parts of the body and growth is rapid, and this is serious and may cause even the death of the patient. So this malignant tumor is the kind of problem that we have to be aware of. This is the kind of cancer that can cause the death of person, or it can cause very serious illness in anyone who gets affected with malignant tumor. Then if we talk about the symptoms of cancer, hoarseness is in voice, cough or difficulty in swallowing, loss of weight or loss of appetite, recurring infections in one single part of the body. Apart from that, persistent lump or thickening in tongue, breast or uterus, then irregular bleeding or blood tinged discharge, persistent sore, and then mole or wart in some parts of the body which may start to appear all of a sudden. So these are all the symptoms of cancer. Now if you talk about the prevention and care, there are few things that needs to be done, and most of these are lifestyle related care. What kind of changes do we want? We need to ensure that tobacco use should be stopped altogether, not only minimize. It's not about minimizing, it's about stopping tobacco use. Then eating a healthy diet, making sure that all the nutrients are there in the correct amount and you are eating a healthy diet and a balanced diet. Healthy weight, it should not be neither very less nor it should be more. Obesity can become a major cause in physical inactivity that can also ultimately lead to one kind of a problem or the other. Exercising regularly, maintaining physical fitness and regularity, and then limit alcohol use, minimizing alcohol as much as possible. So these are some of the steps, preventive measures that can be taken against cancer. Apart from that, avoiding occupational or medicinal diagnosed imaging radiation, because radiation can become a part of the problem. Many a times it can lead to various kinds of cancer. For example, skin cancer, one of the major causes can be exposure to different kinds of radiation. Then treatment of chronic infections like hepatitis B. In case of hepatitis B, in case of HIV, many a times we have seen that it can be a way towards cancer. Then breathing in clean air, regular medical care and treatments may include surgery, chemotherapy and radiation therapy if required. In problems, if let's say in advanced stages this is detected, if the cancer is detected in advanced stages, then in that case possibly the patient will have to go for therapies. After that, just taking preventive measures would not be enough anymore. So that is where surgery or treatment like chemotherapy or radiation therapy would be required. Now the next thing that we have to discuss is allergy. Now allergy is a kind of disease which is very specific to a given person. If I have allergies to something, it does not mean that I would be able to spread this allergy to somebody else. It is not even seen to be genetic in most of the cases. It is not genetic. It's not that parents have allergy to something, the child would also have allergy to same thing. So that's why allergy is something which is very specific to a given person, very specific to a certain kind of gene. And this allergy could be allergy to a wide variety of things. It could be allergy to dust, it could be allergy to pollens, it could be allergy to some kind of ingredient in the food, it could be even allergy to milk, it could be allergy to peanuts, it could be anything. So it could be in the external environment, it could be in your food, it could be in your clothing, there could be anything that your body does not like, and that becomes allergy. So includes a group of non-infectious diseases, no definite cause is known, and can occur due to hypersensitivity of foreign matter called as allergens. So anything against which you have allergies will be called as allergens. What are symptoms? Symptoms could be sneezing, gasping for breath, running of eyes, irritation of throat or trachea, or maybe sometimes skin rashes, sometimes something else. There can be many kind of symptoms that would say that it is an allergy to something. So what are the treatment options against allergies? First of all, avoiding the allergens. If I know that I am allergic to, let's say, milk, then I would have to avoid milk products as much as possible or take it in very limited amount. If limited amount is something that my body can resist and digest, then perhaps limited amount should be taken. So the first thing would be to avoid allergens as much as possible. If you know about your allergy, then medication could consist of antihistamines or it could be of NICS, that is intranasal corticosteroids nasal spray. Intranasal that is intranasal corticosteroid nasal sprays. And then non-medicated treatment like allergen immunotherapy is something also which can be tried in certain cases if there is too much of hypersensitivity against the allergen. So these are some of the treatment options which are available against allergies, but most of the times it is avoidance of the allergens that helps a lot. Now the next disease for us to consider is AIDS. But before we go on into the details of what AIDS is, there are two terms that we should understand. One is AIDS and the second one is HIV. Generally, these are two terms which are used together. You say HIV AIDS. So, is there a difference between these two terms or do they mean the same thing? So, just try to understand this. That when we talk about HIV, HIV basically stands for human immunodeficiency virus. Alright. So, this is a virus. So, human immunodeficiency virus. What does it mean? That if this virus is infecting an individual, then in that case, the immune system of that individual will not be very strong and the immune system may perhaps start to fail because it infects the immune system. It infects the white blood cells. So that's why you will see that if HIV has infected an individual, then in that case, the immune system starts to weaken in that particular person. Now, when we talk about AIDS, AIDS in a manner we say that is the stage 3 of HIV infection. So HIV infection may start with first being acute, then it may become chronic, and then the third stage is AIDS. So what happens is generally there is a count of white blood cells that we see, and this is basically the count of CD4. So this CD4 count generally will be above 500. We see that it is in the range of 500 to 1600 normally. Now what happens in stage 3 is that this count of CD4 drops down to below 200. Drops down to below 200, and this basically means that the white blood cell count or the T cell count has been lowered, meaning what? It means that the immune system has become weak. So this is what happens with AIDS. So what happens with AIDS is that the HIV infection is in stage 3. That is after being acute and then progressing to chronic. Now it has become stage 3, which is AIDS. And what is AIDS? It is acquired immunodeficiency syndrome. So this AIDS is caused due to HIV, due to the infection of HIV. So that's why you can say that HIV and AIDS have a cause and effect relationship. HIV is the cause and AIDS is the effect. And it is the third stage of HIV infection. Now, what is the mode of transmission of AIDS? So, mode of transmission can be sexual contact, it can be blood transfusion, it can happen during pregnancy or after pregnancy, and by sharing needles. Why are these the modes of transmission? The reason is that when we talk about AIDS, AIDS basically may be transferred from one person to another through infected bodily fluid. What kind of bodily fluid? It can be blood, it can be breast milk, it can be semen, or it can be vaginal discharge. All these bodily fluids may have HIV, and HIV may be transferred by the transfer of any one of these bodily fluids. So that's why through sexual contact it can happen, through blood transfusion it can happen, during pregnancy or even after pregnancy it may, and by sharing of needles. So that's why we have to take precautions in a manner that these things should not become a way of transmission of the disease. So that's why checking against HIV infection is very, very important. If, for example, blood transfusion has to happen, so before that happens, there is a test required so that we are very sure that the CD count is in control and there is no problem of HIV infection during the blood transfusion. Then that's why another thing that has been said always is that sharing of needle should not happen. That the same needle should not be used again, so that the chances of infection can be minimized. Again, when it comes to sexual activities, safe sex practices are always advised. So all these are the precautions which are taken so that we can act against HIV infection. Now, when we talk about the symptoms of HIV, what happens is generally HIV in itself is an infection and it is an immunodeficiency syndrome, or it leads to immunodeficiency syndrome, meaning that it is not a disease in itself, but rather it can cause a lot of disease. For example, it can lead to tuberculosis. It may lead to influenza. The person may get diseased very quickly. The person may get infected very easily. So all these kind of things may happen, and that's why it becomes a bunch of diseases together, and it's not one single disease in itself. So first few weeks there will be no symptoms, or it may be slight fever or influenza like infection, but then it may start to progress and other diseases may also start to creep into the body. And then we would see swollen lymph nodes or fever, loss of weight, and in severe cases, once HIV stage 3 is reached and AIDS is already severe and the CD4 count is very low, then in that case it may even lead to the death of the patient. So that's why the problem is, when we talk about HIV, there can be multiple number of symptoms, and these symptoms may be one disease or the other. As I said, that it could be influenza, it could be tuberculosis, it may be any illness which is lasting longer than it should. So all these things become a symptom for HIV. So persistent white spots or unusual lesions on tongue or in mouth, then platelet count becomes less, which may cause hemorrhage. Then persistent unexplained fatigue, nerves are affected, chronic diarrhea, chills. All these things are, as I said, that not HIV symptoms, but rather symptoms for many diseases. So this is what happens with HIV. Now, if you talk about cure, right now we do not have any vaccine or any cure as such, but there are medications which are available which may delay the eventuality of AIDS, which may keep the AIDS infection in check, and the person who has been infected with AIDS may live for a very long time even with the disease itself. So this is what basically happens with AIDS. So right now there is no cure or no vaccine as such, but there are medications. For example, combination of ART consisting of 3 or more ARV drugs for suppressing the disease or suppressing the infection for a long duration of time. People live for more than 10 years, 20 years with the infection if infection has been caught in the early stages. So in that case, we try to keep the HIV infection in check, keep it suppressed as much as possible for as long as possible. Now let's look at some of the preventive measures that can be taken. Cure wise, as we discussed, that there is no cure as such, but we can delay the entire infection, or we can suppress the infection for a very long time. So preventive measures wise, save blood transfusion, testing the blood before the transfusion can take place, protected intercourse, all the sexual activity should be protected sexual activities. For example, use of condoms, for example, is suggested. Then medical care to the pregnant and during pregnancy and after pregnancy, both for the mother as well as for the child. And then use of disposable syringe and needles, so that if at all there was a chance of infected blood being transferred to a healthy person, we should be able to avoid it with the use of disposable syringes and needles. At the same time, many a times, and one of the strong reasons that was seen when HIV infection started to spread all across the world, especially in the Asian and the African continents, one of the key reasons also was drug use. Because of drug use, sharing of needles among all the drug addicts, this was also one of the reasons that HIV infection started to infect a lot of people very quickly, and it started to become an epidemic for the entire world. So diagnosis wise, there is a test called as ELISA test, and ELISA test can detect HIV infection. Control wise, serological screening of blood donors and pregnant women can be done. STD education, that is sexually transmitted disease education, should be a part of general curriculum so that people have awareness against this particular disease and they know what can cause the disease. And then identification of potential infected contact, examination and treatment so that we can suppress the disease and control the disease as much as possible. Now, India has played a huge role when it comes to controlling of AIDS. If you go back into the history and look at how the things were working on when it comes to AIDS as a disease, you'll see that if you go back to 1990s and early 2000s, there were certain medications which were available. These were the medications which could suppress the disease for a very long time. But the problem was that these drugs and these medicines were very, very costly. And this is something which was completely out of the reach of pockets of a common man. Now, most of these medicines were being produced by US based pharmaceutical companies, and it used to cost even more than a lakh per dose per person. Monthly, there was one dose required for a person, and the person would have to shell at least 1.5 lakhs to get that medication. Now, this was not possible for people in the Indian subcontinent or people in Africa. It was not possible at all for them to get this medication because they would never be able to buy these medications. At this point of time, the pharmaceutical companies were not even ready to decrease the cost because they were earning a lot from these medications. This is where actually India came into the picture. Cipla at that point of time started to make these drugs at a very cheap cost. This is where even a lot of controversy happened. So much so that you can say, in a manner, these pharmaceutical companies started to act like a cartel and they started to act against India. At that point of time, the president of the USA, who was George W. Bush, even he started to put pressure on India, started to drag India into TRIPS agreement and all these things, all the technicalities, so that India could be stopped from making these medicines. So this is what was being done. That a medication which was costing more than $1,000 was brought down by India under $2 a dose. So this is the drastic change that India brought in. Although India had to face a lot of issues, a lot of challenges, a lot of pressure from the Western world, but still Cipla as a company did it. And other than that, Indian companies or Indian government also supported it and let it happen at the cost of being called into the TRIPS agreements and sanctions being put against India. So this is the sorry state of affairs that existed at that point of time. That people's life did not matter. Millions of people getting infected and not having medications did not matter because these pharmaceutical companies wanted to earn a lot. They were earning a lot from these medications and they wanted to continue like that. And this is how they were looking at AIDS at that point of time. So that's why, in a manner, many a times you will read about these things in many of the articles itself, that this is where India actually averted a pandemic. India saved the world from a pandemic just by putting its foot down that India will not let the pharmaceutical companies act only for profit and not for humanity. But this is a sorry state of affairs that happened at that point of time. And it also made us aware that this is something that can happen in the future as well. India started to spend a lot in making of generic drugs and everything else after these kind of incidents. So if you want to read more, there are articles and videos available on this topic. You can go through these articles and videos and you'll understand what was happening at that point of time.